Hello, my name is Sarah Wordie and I am a final year medical student here at the University of Edinburgh. So originally I'm from Aberdeenshire in the north of Scotland, but chose to come down and study here in Edinburgh 6 years ago. I think during my time at school, personal health issues made me interested in a career in medicine, and throughout progressing through my latter years of school, I enjoyed the voluntary experience I did within the medical sector, and also the combination of the scientific exams and things like that that made me want to study medicine as a career into the future. I think during the last 6 years here in Edinburgh, it's been a very inclusive medical school, and I certainly faced a lot less barriers than I know predecessors in the years gone by, especially women have. Mostly now it's very split, the medical school, with males and females at the college, with quite an equal split. I think when you're in clinical practice, there's nobody judges your gender anymore, as female doctors are commonplace. So I think from that perspective, things have really improved and progressed in the last 150 years. I've enjoyed Edinburgh as a city, having moved down here from the north of Scotland. It was a different change to me, but I've thoroughly enjoyed it. The course here is really engaging and also mixes both scientific background and research, also with clinical practice, and I feel prepares us very well for the future as junior doctors. Going forward, I'm interested in possibly paediatrics or also surgery. Surgery is something that has interested me all throughout medical school, and is something that has traditionally been seen as a male-orientated specialty. But now female surgeons are becoming more and more common, and barriers are being broken, and females are becoming more included and welcome, and there's no longer the sort of negativity faced by female surgeons as much anymore as there used to be. There are still some negativity around female surgeons, but that is significantly reduced since women have started studying medicine for 150 years. Yes, so if you want to specialise as a surgeon after qualification as a doctor, you then have to choose to do surgery as a postgraduate training programme and sit more exams to be a surgeon, and subsequently specialise within an area of surgery. So you're not just a one surgeon, you narrow down to a specific area. So I'm interested in orthopaedic surgery is what I'm interested in. I think in the last 150 years, the improvement in treatment for patients has significantly revolutionised survival and patient outcomes of hospital admissions. I think that now there's so much treatment available for patients to recover from so many conditions that it's really quite revolutionised the stay of people in hospital, and subsequently their outcomes following bouts of ill health. The treatments are varied from medicines or surgery or to other sort of therapies that don't involve taking physical pills or anything like that. And I think that the variety that we can offer now as a treatment to help individual patients has improved remarkably over the last 150 years. So as I'm a final year student, I'm hopefully graduating this summer, and then we'll start work in South East Scotland in August as a junior doctor. Then going forward, if I decide to pursue my career in surgery, I will subsequently have to sit more exams and more training as a junior doctor before qualifying as a surgeon, and hopefully working within Scotland in the future as a surgeon. I think coming to Edinburgh Medical School, where obviously women pioneered engaging women in medicine over 150 years ago, is something that's very well represented and quite well respected here at Edinburgh Medical School. We see a lot of mentions and obviously remembering these women who have changed and change the pathway and career of women getting into medicine. As such, I feel it's quite poignant that Edinburgh 7 came from Edinburgh. I'm going to be a graduate from Edinburgh University this year, and as a female, that's something that's really quite inspiring, and we must remember that the Edinburgh 7 who sacrificed a huge amount to make sure that women in the future could become doctors is hugely inspiring and remarkable.